This project has been funded at least in part with federal funds from the U.S. Department of Agriculture. The contents of this presentation do not necessarily reflect the view or policies of the U.S. Department of Agriculture, nor does mention of trade names, commercial products, or organizations imply endorsement by the U.S. government. The USDA WIC program is on a journey towards modernization. WIC state agencies across the U.S. are exploring the use of telehealth to deliver WIC services. In 2019, the United States Department of Agriculture awarded Tufts University a grant to help support the use of telehealth innovations for WIC in state agencies across the United States. This effort is known as the THIS WIC project. The goal of this WIC is to help WIC state agencies improve their nutrition education and breastfeeding support efforts, to decrease barriers to access, and increase participant retention. As part of this project, Tufts University extended funding to 7 WIC state agencies through a competitive awards process to implement and test an existing telehealth solution or design a new mobile-friendly tool. Georgia, Michigan, Wisconsin, and the District of Columbia developed projects from existing telehealth technologies. Georgia offered nutrition education and breastfeeding support through a video counseling platform called Pathways. The District of Columbia enhanced their current telehealth technologies by providing nutrition education through video counseling via Zoom and Microsoft Teams and document sharing through doxy.me. Michigan trained staff and piloted video counseling through Zoom paired with online nutrition education, or WIC, tools for high-risk appointments. Wisconsin offered participants optional Zoom appointments and provided enhanced nutrition education through the Online Nutrition Education, or WIC, platform. North Carolina, South Carolina, and Vermont designed and developed new mobile-friendly tools. North Carolina created an online participant portal called MyNCWIC and implemented other telehealth services, including video calls, community-based kiosks, and a TeleWIC service center for remote nutrition counseling. South Carolina also created a participant portal called teleWIC, through which WIC staff provide nutrition education and breastfeeding support. Vermont created a mobile application called Daily Drop that supports breastfeeding education through interactive mini-games and reflection activities, with the goal of increasing both initiation and duration of breastfeeding among participating WIC families. As the THIS WIC project comes to an end, we've invited some of our WIC state agency partners to share their thoughts and reflections. One of the primary aims of THIS WIC funding was to increase access to services for participants who might face barriers. States were successful in using telehealth to address barriers, as well as other challenges related to staffing, communication, and equity. Vermont collaborated with a third-party vendor to create a breastfeeding education and support app that would overcome known barriers by increasing access to WIC services in rural areas and areas of the state with low internet bandwidth.
Kids are busy and work gets in the way and transportation is a challenge. But we really wanted people to have the content for breastfeeding classes. So we thought that if we could create an app that would give everybody the content that was in the breastfeeding class, then people who were choosing to breastfeed or chest feed would be able to find the information that they needed.
In Daily Drop, Vermont updated language they had previously used in the breastfeeding attrition prediction tool called BAPT with more inclusive terminology. This was an important effort in centering equity in the delivery of WIC services via telehealth.
Able to update the language in the BAPT so that now we ask people who first sign on as users of the app, do they prefer the term breastfeeding or chest feeding? And then all of the content comes in the language that they have chosen as their preferred way.
In developing their telehealth solution, North Carolina wanted to increase access to WIC services and improve the focus on tailored nutritional needs. To do this, they offered a number of services with different modalities, including a participant portal app, video calls, telehealth kiosks in local communities, and a TeleWIC service center for distance-based, remote registered dietitian appointments.
Our participants basically had WIC brought to them, whereas before they always had to come to WIC individually. So that definitely created a lot more access for them.
So having this opportunity of the grant to kind of open up an additional flexibility, more availability of services, not only for participants, but also for staff, I think really was a game changer for North Carolina.
In collaboration with a nutrition content developer, Wisconsin used an online nutrition education platform with visually dynamic nutrition education tools to improve communication between staff and participants.
What we found with the tools is that because they're visually engaging, they really lend themselves to a more equitable education messages for both staff and participants. It's very easily that we can share that with participants. It comes across on a mobile phone like you would an app, but it's a website, so it doesn't take up as much data. Then participants have access to all of the tools, lessons, recipes.
In South Carolina, a user-friendly participant portal app with video conferencing capability was developed to enhance communication with WIC participants.
And it is actually a ground up. We built it from the ground up. And it is a video conferencing, so we're able to actually see a video with our participants. We're able to share our materials.
With a focus on reaching high-risk families, Michigan piloted a study in which they integrated video counseling into their delivery of breastfeeding and nutrition education services. The pilot sought to improve access to services and to qualified professional staff, including registered dietitians and international board-certified lactation consultants in both rural and urban areas.
We also knew that in our urban areas, there were some transportation issues. So even though they may have RDs or IBCLCs on staff, it was only at certain clinics on certain days. If that didn't work with families, for transportation wise, there was the barrier with that. And so initially, that's what we wanted to address and make available for those families. From the RD staffing, they were very appreciative that they were able to have a more flexible schedule for families. They were able to potentially limit any drive time once they returned to the office, so they didn't have to maybe drive several hours to a satellite clinic, which then opened up more appointments.
When thinking about implementing telehealth, WIC agencies may want to consider these lessons learned from other state agencies.
Again, we just kind of built that from the ground up, and I don't think that we gave ourselves enough time. It was very challenging. So I would say, just for other states to make sure that you're giving yourself enough time, you check the timeline, and then be prepared, be adaptable, be flexible, because things are going to happen.
So bringing telehealth to North Carolina incurred a lot of bumps, and for other states who are thinking about bringing telehealth to their agencies as well, the advice that I would give to them would be, one, give yourself more time than you think you will need. Murphy's Law plays very strongly in bringing new technologies around, so anything that can go wrong will definitely come up at some point.
A little bit more time and dedicated staff is really helpful. So we did this whole intervention on top of our normal jobs.
Yeah.
So it was a lot. It was a labor of love though, because I think that we really saw the benefit and we knew it was there. So it was well worth the time investment, but it would have been lovely to have someone else come in that's what they did.
I think would be recommended in the future is to have somebody that can really prioritize this work, because it is the day-to-day tasks. It's very involved.
When you mention training, I would actually say make training fun too for your staff. So, making it fun and letting your staff enjoy testing, especially when you're getting ready to implement one of these solutions.
Learn something new takes time, right? Giving yourself time. Somebody might not learn great just listening to somebody talk. So how do we help support staff learning in all of those ways?
In Michigan, many WIC families speak a language other than English as their primary language, which was a barrier to accessing services.
So once we implemented the pilot, we were able to, thanks to Julie, have a contract so that our local agencies could provide those translation services based on the communities they served. I would just say around language barriers, that would be very important too from a health equity standpoint of adopting those strategies.
When thinking about implementing telehealth in your state, consider these key takeaways shared by other state agencies. Plan for more time than anticipated. Maintain staff who are dedicated to telehealth. Make staff training fun. Choose the right tools for your participants. As each state thoughtfully designed a telehealth solution, they worked to make WIC services more accessible and equitable for participants and staff.
I think telehealth is a great solution for WIC because of those type of situations and, being able to be there for our participants where they are.
Right.
We would like to acknowledge the USDA Food and Nutrition Service for granting Tufts University this opportunity. We would also like to acknowledge our 7 state agency partners and the THIS WIC Advisory Board members for their efforts and commitments to driving innovation in telehealth for WIC. To learn more about the THIS WIC project and all of the results, visit our website at thiswic.nutrition.tufts.edu. For more information about the USDA Food and Nutrition Service, visit www.fns.usda.gov. This project has been funded at least in part with federal funds from the U.S. Department of Agriculture. The contents of this presentation do not necessarily reflect the view or policies of the U.S. Department of Agriculture, nor does mention of trade names, commercial products, or organizations imply endorsement by the U.S. government.